The brain is the control center of the body, orchestrating movement, the senses, speech, thought, and memory. This is done by countless electrochemical impulses passed between the millions of brain cells. Though protected externally by the skull, the brain inside has the consistency of watery jello and is very prone to damage from within. An aneurysm is a weak spot in one of the blood vessels in the brain. If it bursts, the rush of blood threatens delicate brain tissue. The brain receives 1/4 of the blood pumped from the heart. Primary vessels rise through the neck and branch at the base of the brain. This is where aneurysms are most common. Neurosurgeon Dr. William Tucker.
An aneurysm is a weak spot on a blood vessel, usually at the base of the brain, and usually at a point where vessels are branching. And this weak spot develops because the aneurysmal wall, or the wall of this little sac that develops, has no muscle or elastic tissue to give it strength and resilience. And so it is prone to bursting with escape of blood in the region of the base of the brain.
The brain is protected by spinal fluid that circulates in an area called the subarachnoid space. A release of blood into this space can damage brain tissue and place extreme pressure on the brain.
When an aneurysm ruptures, bleeding occurs principally into what is called the subarachnoid space. And the patient experiences very sudden, very severe headache. Patient may collapse at this time. They may develop nausea and vomiting. They may have a convulsion, and they may develop neurological dysfunction. That is, they may become weak on one side. They may become unconscious. That neurological impairment may persist for quite some time, or it may fairly rapidly clear.
An aneurysm can develop and burst without warning. Jane Bailey suffered a broken aneurysm a year ago.
I'd had migraines for about 2 weeks. Just awful. Just felt terrible. I was out with friends of mine having a great time, and I wasn't feeling very well, and I sort of said, I've got to go home, and they said, no, don't go home. Don't drive. And I said, no, I'll be all right, and then I just passed out. That was it.
It is possible for doctors to see an aneurysm. One test uses a technique called angiography. With this procedure, a dye is released in the blood vessels entering the brain. The dye is released at the site from a small tube. This is inserted through an artery in the leg and fed up to the neck. This dye is then photographed using a special type of X-ray. Neurosurgeon Dr. William Tucker.
You can see the column of dye in the carotid artery, one of the arteries to the anterior part of the brain. And as you follow that vessel up, you can see there's a blind sac coming off the back wall of that vessel. And that blind sac is the aneurysm.
About half the aneurysms that burst result in death or severe disability, but the other half can be helped significantly. Neurosurgeon Dr. Fred Gentili.
If we can get patients early enough who their neurological condition is stable and they're not in a coma, then there's a good chance for an excellent recovery and getting that patient back to society and functioning normally.
The only definitive treatment for aneurysm is surgery, but it is not always possible in all patients. The aneurysm may be discovered because the sac is causing symptoms such as blurred vision or severe headaches. However, usually the aneurysm has broken. Surgery closes it off by clipping it. Neurosurgeon Dr. Paul Mueller.
You can see that, but there is the clip. There's an instrument that holds it there, a spring-like device that opens like a jaw. We place it across the neck of the aneurysm and close it.
There are several different types of clips. They are made of specialized materials so they can remain on the blood vessel for the rest of the patient's life. This is an aneurysm seen through the operating microscope. The clip at the bottom of the picture has just been applied.
The aneurysm is now clipped.
As part of an aneurysm rupture, you can have a blood clot develop, not just in the subarachnoid space that I talked about, but also in the brain. And part of the operation in those cases would be to actually remove the blood clot tube. But in the majority of operations, basically all we do is clip the weak spot, and basically that's all that's done.
Whenever possible, an operation is done even with minor bleeding because of the risk of a more severe rupture.
The surgery nowadays is done relatively early after a rupture to prevent a re-rupture, because aneurysms, if nothing is done, the chance of them rupturing are very high, and so that re-rupturing is a major concern. The second major problem with aneurysm rupturing is the development of what's called vasospasm.
Vasospasm affects the blood vessels. The blood vessel walls contain muscle tissue. If the vessel is disturbed, the muscle tissue may contract, reducing blood flow. Dr. Paul Mueller.
Very commonly, after a subarachnoid hemorrhage or bleeding from one of these aneurysms, the blood vessels clamp down. The blood doesn't get through and a stroke can occur. Well, even the manipulation of one of these blood vessels in treating an aneurysm, even though we're terribly careful and do it under microscopic circumstances, under perfect vision, it can still result in some clamping down of that blood vessel. We get around that problem by just maximizing the flow, giving fluids, allowing the blood pressure to rise to normal and sometimes even supernormal levels.
During the operation, the anesthetist controls blood pressure. Varying it is one way the vessels are kept open and adequate blood flow maintained. Another complication can arise from the presence of blood in the spinal fluid that fills the subarachnoid space. Cerebrospinal fluid is produced and absorbed by the brain, circulating through the subarachnoid space and down into the spinal column. Blood can interfere with the brain's absorption of the fluid, causing increased pressure.
With blood in the subarachnoid space, sometimes you can get plugging up of the areas of absorption of this fluid, and you can get basically lack of circulation of the cerebrospinal fluid. And this then backs up and can cause what's called hydrocephalus, which is just an excessive amount of fluid within the brain. And in patients with subarachnoid hemorrhage, some 10% of them go on subsequently to develop what's called this hydrocephalus. And in these cases, then what we have to do is called a shunt procedure, where we drain this fluid, which normally would be absorbed over the brain. Now we drain it into another cavity, such as the abdominal cavity and so forth. And this is a little tube that goes from the chambers within the brain down under the skin to the stomach. And it just is it's a bypass really for this fluid.
Brain tissue that is lost does not regenerate. For people like Jane Bailey, the damage means that brain messages aren't transferred as before.
I'm not very good at coordinating. I can't coordinate with the stereo. My arms and legs just don't go together properly. I can't even dance properly. So in that, I'm just trying to really do it properly and trying to hope that one day it'll come back to me.
The damaged brain tissue may affect movement, speech, thought, or personality. However, therapy can help recover some of the lost abilities.
There's considerable potential for improvement. The improvement may take months, may take even a year or more, may require a lot of therapy in acute care hospital. It may require a convalescent hospital, but there's considerable room for improvement.
Just a sec.
After 9 months of therapy, Jane has improved, but her life has changed. Unable to teach as before, she works part-time as a clerk.
Life can be very, very different if you've barely survived something like I did.
Convalescence can be frustrating for patients and families. Changes in thinking and personality are difficult, and both patient and family may become despondent. However, family support is an important aid in rehabilitation.
The family support during that convalescent period is vital to the patient, because he too, of course, may become despondent and discouraged with his slow progress, but progress will occur.